Thank you, Mr. Herodopoulos. Thank you, Mr. Speaker. Mr. Speaker, before giving my remarks about the Affordable Care Act, I do want to mention a couple of things. Mr. Speaker, it is with a heavy heart that I mentioned on the House floor the tragic passing of Greg Biffle, his wife and two children in an airplane crash that happened just a few hours ago in North Carolina. Just wanted to, on behalf of this body and all North Carolinians, express our condolences to this wonderful family on this terrible tragedy, and just knowing that this family will be in our thoughts and prayers of so many around the nation. Also, Mr. Speaker, wanted to let this body know about the passing of a great leader in our state, former Governor Jim Hunt, who passed away today. The news came out a little bit ago from his daughter, who currently is our state's lieutenant governor. A great man, a great leader in North Carolina, one who loved and cared a lot about public education in our great state, a man who I came to know during my time as Speaker of the State House, and someone who loved his state. So our thoughts and prayers and condolences are with his widow and with his family, particularly as we go into this Christmas season. Mr. Speaker, it is, I appreciate the gentleman from Florida affording some time to not only myself, but to a number of our colleagues today to talk about the legacy of Obamacare that we find ourselves inheriting here in this Congress, a program that passed some 15 years ago before I believe any of the members who have spoken so far today were even serving in this body. But here we are in a situation where we are having to try to clean up this mess. And why would I say it's a mess? Well, I can think back to a time before Obamacare, back before this passed, and health care was less expensive. Health care was more accessible. You could go out and you could afford to buy health insurance. Prescription medications were more affordable. There was, in fact, when I talk to colleagues, when I talk to business owners, when I talk to folks, it was easier to be able to get good health insurance. So Obamacare passes, and what happens? We see health care costs spike. We see prescription drug costs go out of control. We see total inefficiencies in the system. We see a lot of wasted money. We see these phantom insured folks, people who aren't really insured, but insurance companies are receiving billions of dollars every year for coverage that simply does not exist. And look at the premiums. Look at a lot of the sticker shock that a lot of Americans are getting right now during this time of the year as we're in the Christmas season, where they're being told they're going to have to pay more. They need to understand Obamacare is what has caused all of this mess. When you move away from a free market system where you're allowed to have greater efficiency, when you have a system that strives for cost containment, but at the same time, great health outcomes, it works better. Today, you hear stories of denials, delays, everything on insurance, and it costs more. That, my friends, is unfortunately the legacy of Obamacare. And it's why this body is not going to continue to throw good money after bad. It's an investment that is not paying off economically, and it's an investment that is not paying off for the health of Americans around this country. Some of the stats, get this, on the plan premiums, the actual cost, the premium cost, Obama plan premiums have risen 2 times faster than employer plans. Got a chart, probably can't see it on TV, but got a chart, and where you see this thing spiking up right there, out of control, those are the Obamacare resulting premium increases that are happening. This is not acceptable, and it's not appropriate to keep throwing money after it. These surging premiums are also driving a higher federal subsidy cost. So what do we mean? So from the ACA subsidy grew from $18 billion in 2014 to $92 billion in 2023. Now, how many people out there think they've actually gotten better health care in that period of time? I don't think many are going to speak up and say they are. Get this, this year, now I've talked about went from 18 to 92. This year alone, in 2025, costs are projected to reach $138 billion. Again, it just keeps going up. My friends on the other side of the aisle, the only thing they know to do is keep throwing money at it, keep throwing money at it. Nothing to try to improve efficiency, nothing to try to improve coverage, nothing to try to improve the system, nothing but wasting more and more money in a system that is not working. If we were to expand, so the COVID extension, that's what a lot of talk's been about. There was a temporary COVID extension that when Democrats were in charge, they solely passed, right? They passed to put that in place, and the Biden administration put that in with an expiration date. Well, they knew it could not continue. They knew it wouldn't sustain. I think, frankly, they knew it wasn't going to work. But get this, let's say we went along with extending that, it would cost right now $335 billion over 10 years, which is going to, again, only put the budget more out of balance, is going to affect our national debt, and is simply not sustainable. The other thing, and I alluded to this earlier, is what's called the zero claim enrollment. That is where folks really aren't even insured. I think they're called phantom insured. It's not real, but it's money being paid to an insurance company. These zero claim enrollments have more than tripled, rising from 3 to 4 million in 2021 to nearly 12 million in 2024. And get this, in 2024, about 35% of the marketplace enrollees had zero claims, up from 20% before the subsidy expansions. At the same time, these insurers received billions in taxpayer subsidies for enrollees who received no care, including, and this is real numbers, $21 billion in 2023 alone. So to those folks watching, those folks who are genuinely concerned about improving access to health care and affordability, know that the Republicans are serious about this. We passed legislation this week to deal with that, to look at some marketplace reforms, to look at association health plans, to look at PBM reform and transparency, to do things to drive those costs down and to make health care more accessible. Also look at the bill we put in a few weeks ago to put $50 billion into rural health care that will help all of America. It'll help my state, North Carolina, but it'll help all 50 states. Because there are areas of our country that they do not have access to health care because of the rural location, distance to hospital, distance to provider, you name it. Putting those funds in there to make this more available. Don't believe a lot of the hype on the other side out there of just spend money on a system that isn't working. Republicans are serious about improving health care for all Americans. The bills we've passed this week, the statements we've made are clear to that. I appreciate Congressman Herodopoulos, my good friend from Florida, for doing this. And I got to say, Congressman, you helping bring attention to this. You did a great job in Florida when you were in the state legislature, the work that you all did to help there. Bringing this issue to the forefront here in Congress. Sir, as a colleague, I appreciate what you're doing.